Maybe that's better.
I just heard you once, so that is better.
Oh, yeah, it's a lot more clear. Yeah. So would you use this on the face?
Yeah, not like you don't want to do too rough with it, but around the nose, like around the mouth, I would just go like this, and you will get small amount of dead skin coming out of it as well too. Of course, if your viewers have been using the LumiSpa, they may not. They're not gonna. I haven't actually been able to, or haven't used it since I started washing my face with LumiSpa. But anywhere else in the body, like the armpit, I mean, it's pretty
Oh,
amazing little thing. All the rage, and I think 3-4 years ago, Gwyneth Paltrow wrote about it in her on her website Goop, and there's a lot of Korean spas in LA. There's one in up in Dallas actually, and they have a designated scrubbing ladies who will dunk you in the water and scrub your whole body. And if you read some of the reviews of the people, I mean, it's like a literally being reborn. Like your skin is being, you're shedding, years of dead skin if you're not Korean and haven't scrubbed yourself ever. We take care of a lot of neuropathy patients here at my clinic, and most of them are seniors. And when they take their shoes and socks off, literally their flaky dead skin is flying in the air, and you can see them shedding the flaky skin on the floor. And that's what the scrubby will prevent. And I've actually had friends who got introduced to it and used it and said that they can actually feel things better, because that barrier of the dead skin that's been sitting on them has been, it's been shed now. So it's a pretty amazing, nifty little thing. Your viewers can go to Amazon and read the reviews of the scrubby. They're quite some of them are quite comical, and but people talk about how they use it, and like a life-changing experience. And that's like what, $3.50 little thing that I think it's a must in skincare, and will go very well with the Lumi Spa and all the other new skin products.
yeah, cool. I packed it up here. We got all these little types of gift bags.
Hmm.
And certainly I'm definitely going to be using it if it's going to help me look as young as you do. You
the
you
key
don't age.
the key is don't use any soap or bath bombs, or just stay in the bathtub good 10-15 minutes, get yourself slightly pruny, and then just start getting a good track on your skin. You will be amazed. I almost I tell people it's like it kind of ruins your bath experience, because now when you sit in a bathtub, you get this uncontrollable urge to scrub yourself.
What
So there
about like Epsom salts? Would that
um
interfere? Because I've got like
uh
these.
yeah, Epsom salt does make your skin look slightly slippery, and anything that will make your skin slippery, I don't advise you use before it. You can use it after. Scrub for like 5-10 minutes, and then you're going to be sitting in a pool of your dead skin in your bathtub. But afterwards you can use the Epsom salt or any other bath product that you may enjoy using.
Okay, cool. I see you. I have my Ember cup too.
Oh, you got a gold one.
It's
See if
so
I
pretty. What color is yours?
can but
Nice.
to
This
think
thing's
about.
awesome. I absolutely love it. I can't believe it keeps my coffee hot. That was my biggest problem. I was always running to the microwave, which I know you're not a fan of the microwaves, are a bad deal.
You will microwave anything. I haven't touched that thing for like 20 years. It
It's out of here now. I don't even need it anymore. That's all
Yeah,
I really used it
um
for.
there was a very novel study that was done many years ago. First of all, the government of Russia, when microwave first came out, banned it. It's real. You're really micro radiating your food, killing all the nutrients and changing the structure of the nutrient in the food. And there was a very novel study that was done by two or three scientists in Switzerland, where they drew up the patient's blood after eating microwaved food, 30-minute, 1 hour, for good 3-4 hours, and their white blood cell count basically noticeably decreased after consuming microwaved food. So somebody I know, you were very public about, doing the chemotherapy, and somebody who needs to have a good immune system. Like, I wouldn't even stand near a microwave, you know?
Yeah, well, it's since you brought that to my attention, I mean, I kind of thought it was an old wives' tale in a way,
Oh,
but
God.
since you showed me the article and you brought it to my attention, I haven't really used the microwave. I just used to use it to heat up food occasionally and to heat up the coffee. And
Yeah.
now I just put the food in the oven,
Yeah.
to your suggestion.
When you stop using microwave, you just kind of realize, like, you don't really need it. Like, I don't need it, and there is a substitute that you can purchase as well, very inexpensive. I think it's called a hot plate, but basically it's like a thermos type of insulated, like a lunch bag that has hot plate that warms up your food if you put like a glassware container and plug it in like an hour before your lunch, and your food will be very warm. And I have used that in my office when I bring lunch here, and so that I avoid using microwave, but I still get to enjoy warm food at work.
Cool. Okay, I'm gonna look into that. Maybe it'll go in the little hole where my microwave now is. Hey, so I also have this in this little package, which, by the way, I can customize these packages. This one with all these goodies in it is just like $80. It's got a whole bunch of makeup in there. But did you take your collagen yet today? I'm so
Yes,
ready to look. I've been doing double dose of the collagen lately.
I know you mentioned that doubling the dose will have an orthopedic effect as well too. I was kind of like perked up to hear that.
It's just
I
more of a orthopedic therapeutic dose of the collagen, because the once a day is really just for the beauty focus, the complexion. So obviously we need more collagen, and you're the doctor, you're the expert with your regenerative clinic and your orthopedic focus. I mean, you know that
right.
too. So what would your feedback be based on this?
My feedback, well, first of all, why I decided to try it and what impressed me is we've been prescribing collagen here for a very, very long time, for many years, because collagen makes up really the foundation of your whole body. Your arteries, hearts, organs, your colons, your skin, even your bones are all made up of collagen. And even your bones made up of your collagen. So collagen just really makes all the structure of our body. And what happens when we get older is we just don't produce enough of it, and hence the downward you know what I'm talking about, the downward direction of all our body, including the face. We end up with the turkey neck, and our breast, the sag, and you don't have any, come on, but the arm being saggy. So this
Yeah,
downward direction, stop it. So the downward direction of these, our body, from the loss of collagen, doctors commonly call it the pitosis or ptosis. And if you think of any medical condition that has the word prolapse, right? Like a lot of women, as we get older, we get uterine prolapse or bladder prolapse, vaginal prolapse. All this prolapse condition is all caused by the lack of collagen. Okay.
oh my goodness, and that's a big problem, a big problem.
That is a very big problem. Yesterday, I had a patient who came in and said that in 2 weeks she's going to be getting a bladder sling or some type of procedure that holds her bladder up, because she has a quite severe case of bladder prolapse. So
Oh,
we've been prescribing collagen, and anything I recommend in my clinic, we just give the best of the best. Almost a pharmaceutical grade, high grade, like powder supplement of collagen that we give to almost anybody, not just joint condition, but the neuropathy patients. Those damaged nerves are also wrapped in collagen as well too. So been using that for a very long time. And what I discover or learn is that the vast majority of the collagen product that's out there have a huge molecular weight. the molecular weight or unit that is being used to measure the size of it is called the Dalton. So average supplement that you may find available from like a store, they have about 45,000 kilodaltons of molecular weight, which makes it very hard for our body to absorb. So the collagen product that I was using in here for clinical purpose and home prescription, the closest, the smallest I could find was 4,000 Dalton, and in really like a hydrolyzed form, meaning it's broken into a smaller amino acid for better absorption. And it really piqued my interest when you introduced me to the new skin collagen. And correct me if I'm wrong here, but I think you said I think the doctor that does the talk for new skin collagen has a molecular weight of 2,000 Dalton. And I think that is the smallest the collagen or peptide molecular unit that I have been able to find anywhere. I mean, sometimes if I find a collagen substance, I even contact the company and I ask them, hey, can you share with me what the molecular weight of your collagen product is? And they're quite huge. I've seen good quality product, 5,000, 6,000. The one that I was using was about 4,000, and New Skin Collagen is 2,000. And I have not been able to find any collagen product that comes in that small of a molecular weight, which tells you that it probably has a really good absorption rate. And some of the before and after photos that you share, you really see dramatic changes in people's faces. Of course, the New Skin, the cosmetic company that it is, has other formula mixed into, really beautified. And some of the photos that you've been sharing have been just really phenomenal. Like within a very short period of time, some of the photos you share, like within a week, right, just looks so fantastic. So my personal experience, I've been taking it for about 3 months now, I think. You can say that blessed with a youthful look from my parents. I call it the Asian advantage. I find wrinkles or anything like that, but so my improvement may not be as noticeable because I didn't look that bad before. That makes sense, but I noticed a subtle difference. Like I think I look more glowy, and I do look more fuller. Like again, it's one of those things that I only notice. I wish I would have taken like really good before and after photos. I just didn't do that. I really just tried to ask me to. And I'm just pleasantly surprised at the result. And it tastes really, really good too. Yeah, so that's my 2 cents on the collagen products. And
I think you bring up such a valid point, and coming from a doctor, really talking about the absorption and the molecular weight and the size of the peptide and the fact that it's hydrolyzed so it can be absorbed. I mean, it's all great if people take the time and the investment to put a collagen into their body, but we really want to maximize what they're doing. I think the powdered collagens that you get at the grocery store, I mean, it's a great step in the right direction, but the absorption rate's only 3% versus 90%, this small peptide, this hydrolyzed collagen. 3% versus 90, that's huge. I will pay a little bit extra for it. Of course, everybody's budget's different. At this point, I'm taking 2 of these a day because, I mean, you know how crazy I am about trying to keep the hair. And, so far the hair literally hasn't fallen out. No,
yeah,
I mean,
that's amazing.
it like I'm not even shedding as much as I usually do. So
That is amazing.
fingers crossed. I have some messages coming in. I've been taking 2 of these a day. Also for some of the reasons that you say, because the collagen is like the scaffolding of your whole entire body, and this chemo like wreaks havoc on your body. So I'm really trying to fortify it with this. There's antioxidants in the collagen, the lutein for glow, and the phytoceramides for like hydration. I do feel how strong that chemical, those chemo is, after going the the one day I'm kind of like the body feels like it had an atomic bomb it was
Yeah.
exposed to. So I feel like taking this is just one step in the right direction to keep myself fortified, and it
Well,
seems to work.
there is a doctor who has a talk, and a lot of information that I learned from him. I've been actually following this guy for since I was a student, so over 20 years now. His name is Dr. Tim Oshaya, and he talks about improvements that he sees with the collagen supplementation, even any prolapse condition, by the way, uterine prolapse, any prolapse condition, improvement in their skin tones, heart failure. Basically the collagen that holds the heart is just falling apart. Heart functions returning. Or of course, the really good results with the arthritis as well, Tony. He does talk about cancer as well too. Cancer patients responding favorably with the supplementation of collagen. Of course, I don't want any of your viewers to think, oh, she's claiming to cure cancer with collagen. That is not it, okay? Don't get crazy. But yeah, he also talks about that as well too. So I think it's just one of the things that as we get older, you will just benefit from supplementing it. And going back to the absorption of it, you have no idea how many times I've seen patients who takes like, calcium vitamin D supplement that don't dissolve, and they show up in colon when we take their lower back x-ray.
Oh my
Also,
goodness. Oh, oh my goodness. That's
yeah, so
crazy.
I call them expensive urine or expensive poop, because you
Oh
pay for
yeah.
passing right through it.
Oh
So
man.
I'm a big fan of vitamin C, vitamin D. Just make sure that you're taking quality supplement that has a good absorption rate. I think that is the name of the game. I'm a big fan of supplementation, orthomolecular medicine, and I think it's worth it to make an investment to buy a higher quality supplement that your body's actually going to benefit from, instead of just passing in your pee and poop.
Absolutely. And for everybody who's watching or who does watch this on the replay, Dr. On's clinic, Campbell Medical Group, is in metropolitan, one of the greatest cities in the world, Houston. And it's a very busy clinic, but yet I'm a patient there myself. You feel like all the attention's focused on you when you go. For I don't know how they do that. Her whole staff is super attentive, and she is like on the cutting edge of medicine and regenerative medicine, always looking for like the most natural, like holistic type of ways to care for her patients. Am I saying that properly?
Yes, you are. Yes, you are. And the way we see it, like, so our philosophy is, I asked the patient, when was last time you visited a doctor where the end result was not some kind of pharmacological solution, right? They may run some test and then they diagnose you or give you a name, and then, but the end result is almost always the same. That is some type of pharmacological approach to the problem. So, um, people who's already gone down that path, or patients who knows that they don't want to go down that path, is what we feel. We fill in the gap of those patients that don't want to go that route. I enjoy my work greatly, and fell in love with the regenerative medicine about 7 years ago. And yeah, so I'm always traveling on weekends and studying and taking courses to learn the best and the latest for my patients. Yeah.
I know you've certainly helped me, and I love that the red light that you gave me too. That is just so amazing. Started using that for my eyes,
Yeah.
which are, I use it for my back. It's like I can feel myself healing. I love that. It's remarkable. So many great things that you're doing in your clinic for patients with neuropathy too, which that's a lot of patients don't know that there are solutions for that, and non-pharmacologic solutions that are effective. That's really a great work you're doing.
these patients are just miserable because everywhere they go to, I have patients who's traveled to Mayo Clinic only to be told that there's nothing that can be done about it. They have to live with it. They have it because they had chemo. You have it because you're diabetic. And we have a phenomenal success rate with those patients. So
Cool. Well, anybody who wants to learn how to find Dr. An, just reach out to me or it's Campbell Medical Group. And Dr. An, thank you for joining. I'll cheers to you with my collagen.
warm
And my coffee. I'm